this is Pam, and I'm going to give you a brief overhaul of my business model canvas for my urgent care and occupational health service, part of Valley Health Systems in Winchester, Virginia. We are a urgent care and occupational health that serves a community of underprivileged and underinsured patients, and also a larger industrial business sector, which feeds a low overhead, highly desired service of occupational health. My urgent care center is traditionally sought after for things such as colds, flu, coughs, those traditional things that are sought after after hours when your primary care physician is just not available, or on weekends. So if I were a new entrepreneur in the healthcare industry and creating a business model canvas, this might be something that you would see as I create and analyze, would this business be a feasible opportunity for me? Now, according to Oshkwalder and Pignor, I am going to start with assessing my value proposition for my new business. And so those are things that are going to ask, like, what is the value of my business proposition? What is my value, and what am I going to do? And so for me, I am going to look at what is my niche? What am I going to do for my community? I'm going to serve my community by offering convenient hours, quality providers, a continuity of care. I'm going to do on-site services, same-day appointments, things that are going to add value for my patients. And then I'm going to come over, I'm going to see what are my customer segments. So once I identify who I'm going to provide value to, who are my segments? I'm going to do I'm going to serve the community, my larger patient population. Are they insured or not? That doesn't matter. I'm still going to provide them with quality health care. So once my customer segment is designed, then I'm going to go down and I'm going to look at how am I going to channel that? What resources and what avenues am I going to use for that? And I might look into social networks such as Yelp and Facebook, look for word of mouth advertisement, marketing, what am I representing with my budget that I have for advertising and marketing. We're also going to look for, maybe do I have a customer or occupational health liaison? How am I going to get into the community with local community events such as job fairs, healthcare organization fairs, things like that? How am I going to get my footprint into the community? And then Megan's going to show you then, after that, I'm going to look for, how do I do that? Well, I'm going to look into my customer relations and relationships. And who are my customers, and how am I going to form the relationships? And I know that I'm going to have internal growth, and I'm going to have to offer customer service in order to build the relationships with the customers that I've already identified that I'm going to be serving, and that's going to give me longevity, and that's going to give me the growth within my industry. And then according to the business model canvas, I'm going to then look at my key activities and how am I going to build that? Well, I'm going to have a strong supply chain management. And I'm also going to have strong education and internal growth and support and technology, retention and staffing. And those are the things I'm going to look toward as a healthcare entrepreneur building this business and building my relationships with and growing retention and my staffing strategies. And then next on my business model canvases is my key resources. And let me go back to this. I'm sorry. My key resources. And in that, I'm going to find that I'm going to need to have a very strong employee occupational health service. I'm also going to have a very strong electronic medical record system. I'm also going to have to rely on the government because they're going to be largely reliable for reimbursing me for Medicaid, Medicare in my business. I'm going to look for the opportunities within my local university and colleges to have growth, internal growth within support for my clinical realm. And so quickly as we move on for time, I'm going to look at then who are my partners. And again, I've talked about my university and my colleges. I'm also going to have to seek an internal billing department because that's going to save a lot of revenue for me. What are my alliances? Who are going to be my business partners? They're going to be physicians, emergency departments, my other urgent care centers that I'm going to rely upon for staffing and a volume support. And of course, the larger hospital systems, because I'm going to need labs, I'm going to need outreach, MRIs and CAT scans and things like that. Very quickly, that takes me down into the last two segments of the business model canvas, which are the revenue streams. And where am I going to get my revenue from? Who's going to pay for my services? Well, it's going to be, I'm going to generate a high cost per encounter by every patient who comes in. They're going to have as many services as they can have, x-ray, labs, things like that. I'm going to offer a low overhead for occupational health services and high reimbursement contracts from the government, as high as the contracts that I can garner from the government. And then what is my cost structure? Who am I going to be paying? I'm going to be paying staffing, my patient supplies, my durable medical equipment, like, splints, crutches, things like that, pharmaceuticals. Those are our costs that I'm going to have to consider when I'm looking at, as an entrepreneur, am I going to be able to start this urgent care and occupational health service? So all of those things together, I am going to determine in the end that I would garner that this is going to be a well-established business and I'm going to be able to be successful. I have many key indicators to support the 9 different dimensions of the canvas, and particularly in the areas related to internal support and community partners. So with this, I would feel very secure in creating that future business plan based upon this model in the healthcare industry. I'm going to have the strategies, and I'm going to be able to provide supplemental health care in a primary care provider model and give a continuity of care that my patients and my community are serving. So if you have any questions, feel free to reach out to me within the business forum on our school website. Thanks. Bye.